The topic was built for this discussion as the shifting paradigm in professional development in leadership and management in healthcare. So our intention with the panel is to unpack some of what is underneath this shifting paradigm. What are the key disruptors that are driving change in professional development in healthcare? How are practitioners and their organizations responding to some of these disruptions? What lies ahead of us, etc. I'm going to just introduce each of them very briefly and then let them make their opening comments on the topic du jour. So first I'll start with Emily Grunwald. Emily is currently president and CEO of the Children's Healthcare Canada and the executive director of the Pediatric Chairs of Canada. I'll now introduce Alain Doucette. He may not need introductions in this audience. He's a Telfer alumni, now president and chief executive officer of the Canadian College of Health Leaders. And finally, and certainly not least, I'll introduce Mamta Gautam. Mamta is also a Telfer alumni and is now president and CEO of Peak MD and also a psychiatrist at the Ottawa Hospital. So she brings a perspective as physician, but as well as a leadership coach, and is becoming known as the doctor's doctor. She's a real trailblazer in the areas of physician health and in physician leadership development.
So emerging health leaders, or emerging leaders in general, tend to be very bright, bold, and ambitious. They have high expectations of themselves, but also their senior leaders. And so today I just wanted to chat about 4 of many ways emerging leaders are disrupting our workplaces, our healthcare systems, and helping to shape how we might approach professional leadership development into the future. So the first way is, I think, long overdue. Emerging leaders are driving the shift from ideas to action when it comes to equity, diversity, and inclusion in our workplaces, in our health systems more broadly. And in the face of local, national, and international conversations on racism, stigma, and discrimination, emerging leaders are passionate about social change, and they're calling out organizational policies, practices, and assumptions that create barriers or prevent vulnerable or minority racialized peers from being engaged, being supported, enabled to reach their potential, or even to access health services. And they really mean business. And lastly, emerging leaders seek connection. Whether it's face-to-face or now virtually through platforms like this, leaders are looking for face time with their leaders that they look up to. Most emerging leaders are building networks and relationships now over social media, and especially when traditional hierarchical organizational structures or a global pandemic prevents young leaders from connecting directly with their senior thought leaders. Social media platforms are evolving quickly, and as a leader looking to develop your talent, social is the world where showing up is everything.
There are, of course, other disruptions, consolidation in healthcare, cost constraints, and other factors. And so we've tried at the college to kind of look at all this and think about new models of evidence, delivery, and engagement. And so I've got a list of 8 pivots or trends, if you will, and I'll go through them fairly quickly. And I'm happy to come back to any of these for a more in-depth discussion if you like. So pivot number 1 is the need for new models of evidence and research. There's still a place for traditional scholarly research, but those of you who are engaged in this endeavor will know that that's typically a 2 to 3 year kind of cycle. And in today's rapid environment, in a pandemic, when you want to bring your leadership development practices current and in context, you don't have time. And so you need to find new models of research. And the last one is this notion of lifelong learning. That's been with us all along. It's going to continue being with us. It connects back to the professional certification and maintenance of certification, but people want to be on a journey. It's an ongoing journey, different phases of careers, emerging leaders, mid-careerists, executive, retired leaders who can be coaches and mentors. There's different phases, but it's a lifelong process. So you join, you take courses, you do your designation, you do your fellow, you become a coach and a mentor, and you learn all along. So we would continue to reinforce our commitment to lifelong learning.
You know, what I would like to add, I think as a physician, as a psychiatrist, is that as we move forward and change in healthcare, which is important to do, and to Alain's point, you know, in the spirit of continuous learning, it's really critical to ensure that compassion remains the foundation of healthcare. So what's compassion? That's like the sensitivity that we would have to the pain and suffering of somebody else, coupled with a deep desire to alleviate that suffering. So it's not just recognizing it, but actually being moved to action, which is what leadership is all about. And my concern is that compassionate care is really vulnerable in the middle of all of this. And so, you know, you stack that against the imperative to be more efficient, sort of that distancing gaze that science allows us to have, some of the logic of, you know, things that are more automated now. And so the threat is real. Right. And so we may sort of gain a gift of time, but is that gift of time going to be something that we reinvest into better patient experience? Or is that something that we're just going to use to treat more patients, right? So is it quality over quantity? And that's something that I think is important. I just want to wrap up by saying that, you know, compassion overall, as we think about what is compassion, what is compassionate leadership, it's really a 4-part process. And to think about how you would do it and perhaps how you currently do it. So the first part is just noticing. Right? What are people what are people feeling? Is suffering present? And how do I, you know, how am I open to noticing that? The second is interpreting it. So I can see it, but how do I make sense of it for myself, for the person, and the impact on people around them? The third is feeling. Right? How do I have that empathetic concern for the person that's suffering? And then finally, the fourth is action, right? That we have to then be prepared as a compassionate leader to step up and alleviate that suffering in some way. I think that, you know, part of leadership, though, is to influence followers, right? And to inspire the followers. So I think that it's a really important part of that. But I will say this often when I teach leadership courses, I'll say, you know, leaders need followers, right? And so, you know, I need to be, as a leader, I'm walking along and I need to look back and see that there are people following me. If I'm just out there walking along and there's nobody following me, like, am I actually leading or am I just out for a walk?
We all really appreciate your committing to have this discussion with us today. So thank you again.